lucky Jen.
So this is flash cupping. So there's 4 types of cupping. One is just stagnating cups, where you just put the cups on, and what it does is it basically lifts the skin so that the fascia can breathe underneath. Another one is you put one cup on and you do what we call sliding cups, and you just kind of slide it up and down.
What you did earlier.
Yep.
Okay.
And then this one is called stagnating cups, and you just kind of leave it on a certain area that needs it. You can see that its back is turning red. It's turning a little bit purple too, so like therapeutically the cups lift the skin so the fascia can breathe underneath, but diagnostically it tells us what else is going on. So if the skin turns whiter than what it already is, it means that there's cold lodged in the interstitials. Like you can see right here, there's a little purple and white in there straight down, right? So
Yeah.
if it turns pink or red, it simply means a person needs a little bit of muscle release, massage, and they're gonna feel better. But when it turns purple, it means that there's severe stasis and blood stasis. And so the way to get rid of that is to bleed the person. So you can see where he's kind of stagnant is here and here, right? So
Wow, I didn't realize.
see how he has, yeah.
Yeah.
Do you want me to bleed you?
No.
He's afraid of needles. He would actually feel better if he was bled, especially right up in this area where it's purple. But what I'll do is I'll just put him on one more time, and what we'll do is we'll do stagnating cups. But it's a very simple process.
So
You
you
can
only
lead her.
Just put the cups on.
you only do in that area. You don't do
Well,
the
you can go on the
sides.
sides too. Yeah, I can bring it out.
Would it have a different effect on?
It's just going to cover a larger surface area.
He's feeling tired.
Oh,
Yeah,
it's so
make it
weird how
tight.
you can see the skin pulled.
Yeah.
It's so cool.
Yeah. So how does it feel?
It feels different.
What do you usually get from the benefit of this? I know you said that you like having this done, but what do you notice when you have this done?
My back doesn't feel so tight.
Okay, so it loosens up the back, and you've had pain before you've had this done before too, so it
Yes.
reduces the pain.
And mobility comes a little bit better.
You have a little bit more flexibility and mobility. Yeah, so it really, as you can see, he could really use bleeding, but that's okay. You know, the person has to be ready to go to that next step. A lot of people take it this far and they fail to miss the last step. This is therapeutic, but you got to look at the diagnostics and see what else needs to be done. And then if you really want deep healing, you got to go that next step. Of course, you got to be sure it's the right person to be doing this for. You're not going to bleed anyone that is taking Coumadin actually, because they're like taking blood thinners. That would not be ideal. You wouldn't bleed a pregnant woman or an elderly or a person who is just of very deficient quality. So.
Wait, now how do you actually bleed? What
What
do
you use is a lancet needle. You sure I can't demonstrate this on you?
No, I'm very sure.
It's really oh, he's in the
I'll show you. I'm not going to do it. But so lancet needle that a person that's diabetic will come and check their blood every day. Use this. You go pop, pop, pop. You put the cups back on, and 1 to 3 drops of blood will come out. So the body is made up of 60 to 70% of fluid. So if there's stagnation of blood, if there's a compression of this disc in the spine, right, the vertebra, well, what happens is the blood will pool there. And so if the blood is pooling there, then the fluid of the body is going to pool there. You're going to have poor circulation, and then you're going to create what we call a beaver's dam. All the blood is going to congeal and coagulate. It's going to be unhealthy blood. So if you want to heal, you got to get rid of that. The easiest way, if the person's in good condition, healthy, and not taking that blood thinner medication, then you can definitely go ahead and bleed it. So
So you're not gonna let her do it to those one spots?
no, he doesn't like needles, so that's fine. You have to kind of gauge it to what people can tolerate. But it's something that he would, if someone came in and said, oh, I just herniated 3 of my discs, you might consider that as an option.
Yeah.
Because you're not going to do massage on someone who's just herniated some discs. You have to be very delicate with that situation. Yeah. Some people like to have the cups stay on their backs for about 5-20 minutes.
What?
Yeah, they just want to sit here. I use it as an adjunctive therapy, besides doing sports medicine massage, and we'll do cupping, then we'll do acupuncture. Then we'll follow it up with maybe a little bit of energy work, and then from there we'll do a little bit of bone setting. Yeah, I'm being a little bit more aggressive with him only because I've worked with him a bunch of times, so I'm not going to baby him like I would somebody that's starting for the first time. You can make it foo-foo-y as you want. Which he probably likes the foo-foo-y one, but he's got a lot going on with his back, so yeah. And that is good. Make sense?
Yeah.
So you can see also, see how his back is kind of softened up since we
Yeah.
did that? It's kind of really relaxed more now. Yeah.